afternoon, Frederick. It's been over a week since I declared a state of emergency in the city of Frederick and instituted operational adjustments for our city departments. Since then, cases of COVID-19 in our community are increasing daily. Governor Hogan continues to take strong steps at the state level, enacting executive orders that are changing how we function. Frederick Health has opened a drive-through testing facility. Frederick County's health department is working to trace cases and keep the public informed. I know you may be fearful or anxious about today and what is to come, and while we may not know what the future holds, the City of Frederick continues to maintain operations that are critical to the life, health, and safety of our residents. The city is also focused on the delivery of all city services through alternative means to keep city employees and the public safe. I want to assure Frederick residents that the city is working. We are working hard and in innovative ways to support our community, and we want to keep you informed. Moving forward, I plan to provide public briefings on city operations and our COVID response on Wednesdays and immediately as needs and information warrant. Today, I have a few updates and announcements. First, the Frederick Police Department will always prioritize public health and safety. Patrol checks are continuing. Response to in-progress calls for service is continuing. Traffic enforcement is continuing. And the police department is enforcing the governor's executive order on mass gatherings. We urge you to support these efforts by adhering to the governor's executive orders and to follow social distancing recommendations. Our work to support the most vulnerable in our community is evolving as the needs grow as well. Last week, in collaboration with the Salvation Army, the Frederick Community Action Agency mobilized its food bank to serve local seniors and households. Food bags, which hold 3 to 5 days worth of food, were delivered to Tawney Village and Catoctin Manor. Our next delivery is tomorrow. We are also finalizing a plan to offer weekend food resources to support households soon. Additionally, by the end of the weekend, additional restrooms and hand washing stations will be placed at critical human service locations in the city, specifically the Religious Coalition and the Rescue Mission. During this pandemic, we want to ensure that all residents have access to health and safety resources. To support our business community, we continue to find ways to supplement and respond to state initiatives and orders. The downtown curbside pickup zones have been successful and will continue. In addition, the Department of Economic Development is activating some of its fiscal year 2020 funding and redeploying those dollars through a small business micro-grant program. While funding is limited, this program will provide up to $2,500 to numerous city small businesses to help with rent, mortgage, and utility costs. DED will be announcing the details of this program later this afternoon, including a way for those in our community to contribute to this effort if you are able. Operationally, we continue to adjust our deadlines, protocols, and processes to ensure the work of the city can continue, but in a safe way for our employees, residents, and partners. I will say that it has been a challenge as we've worked through transitioning many of our employees into teleworking environments and making sure that they have access to the technology they need to continue to provide the high level of services that our customers, our residents expect. Previously, I had announced that all public meetings were postponed through March. To allow the public to engage in our public meetings effectively and to ensure that the city is meeting the legal requirements of the Open Meetings Act and our city charter, I'm taking the following actions on public meetings. Workshops and meetings for Mayor and Board of Aldermen, Planning Commission, Zoning Board of Appeals, and the Historic Preservation Commission will begin again the week of April 13th, 2020, in virtual and limited gathering options. Complete details on agenda items and public comment opportunities will be announced shortly. At this time of year, we would typically be embarking on a series of budget hearings. Our budget department is redesigning that hearing schedule which will be announced next week. And to reduce the risk of exposure and spread, all non-judicial boards and commissions, as well as our NAC meetings, are currently postponed and will be so through the state of the city's emergency. We'll be reaching out to those boards and commissions to provide updates as warranted. Citywide operational adjustments for city departments are available on our COVID website, cityoffrederickmd.gov COVID-19. In addition to that website, I ask all community members to sign up for our email and text alerts. This continues to be a rapidly changing environment, and we want to keep you up to date and informed, and those resources are the best we have available for you. Through this pandemic, and as Maryland celebrates its 386th birthday today, Happy Maryland Day, Frederick is showing its strength and commitment to community, as the impact of COVID-19 is still unknown. Thank you to our city employees for their hard work to address these unexpected times. Your response and commitment to the life, health, and safety of our residents is unwavering. Thank you to our community partners who are finding a way to provide essential services to our neighbors in need. And thank you to our residents and community for responding to these unexpected times. Despite challenges and many unknowns, and while adhering to social distancing recommendations, our community is clearly committed to helping and responding. Through ordering takeout through our local establishments, by sewing masks, reconfiguring manufacturing operations, contributing to local fundraising campaigns, checking in with neighbors and friends, and by giving blood, which I will be doing tomorrow. Through the Red Cross's online process, anyone in the community can sign up to do that, and there is a desperate need for blood today. As we continue in these uncertain and challenging times, please continue to take action and be safe. Thank you, Frederick. I'm now available to take any questions from the media that have been able to join us here at City Hall today. Katie, thank you. The question was about the number of cases in Frederick County, 8 cases so far, and I don't have any reason to believe that number is not going to go up. Everything we're seeing is that the numbers continue to rise, and the uncertainty in this situation is not knowing when we're going to hit that peak. And so that's why the message has to be continuous. Practice social distancing. If you don't have to be out in public spaces, in gatherings, even in small gatherings now, don't. Stay home, work through your proper hygiene practices, but it is really critical. The objective here is that we know that there are going to be people who are going to get sick, and we know that the infection is going to spread. What we are trying to do through the social distancing and the other steps that we have taken is to keep that surge on our healthcare system at a level that our healthcare system can manage. And we're seeing in other places where that is not occurring, it becomes a real challenge when there aren't enough beds, there aren't enough ventilators, there aren't enough personal protective equipment available for healthcare workers. Our goal in Frederick is to do everything that we can as a community to not overwhelm the healthcare resources at our disposal. And if everyone in the community can do their part, then we may still see the curve, but we will flatten it, and that impact will be felt over a longer period of time, and we won't see the imminent impacts on our healthcare system.
Have you personally heard from any from the hospital here of the
In the conversations that we've had across the healthcare community, and we're participating in a variety of levels at the state and at the local level in teleconferences to be updated, that is the issue. The issue is the amount of bed spaces available across the state. It's going to be about the amount of available bed spaces within individual communities. And certainly in the metropolitan areas, as I heard today on a conference call, the concern is about cross-surge, people from other jurisdictions outside of the state of Maryland coming into Maryland because they may be facing challenges in their own jurisdiction, putting pressure on Maryland resources as well. So the call to our residents is to take all of the proper guidance that you can from the CDC and the World Health Organization. Practice good hygiene, practice social distancing. If If you think you need a test, there are protocols in place for you to find out whether it is warranted for you to get one, and then to follow the CDC's guidelines for isolation and quarantine if you think you've been in contact with people who have been infected.
Are you guys kind of pushing everything back to the first meeting, April 13th? How much of that has had an impact so far for you guys? How much of an impact that?
What we have taken the time to do is to look at the agendas that we are missing. So we missed a meeting last week. We have a meeting that would have been scheduled for next week, and to look at those agenda items that have really time sensitive. From our perspective, it's all time sensitive to the extent that we don't want to have everything back up too much. But there are contracts that we'd like to do things with. There are projects that we'd like to award and move those things forward. We want to make sure that we're compliant with any deadlines that are in those contracts. So far, we're not seeing direct impacts, but that's why we want to be mindful of these deadlines. We have some leeway, and we're trying to operate within that leeway, but we know that the longer that we put some things off. I'll use a small example is that one of the routine actions that the city does is that when a project reaches completion and we're holding letters of credit on those projects, we'd like to be able to release those letters of credit because that puts that funding that the city is holding back in the hands of those businesses that had posted those letters as a part of the project they were working on. It's a simple administrative thing that doesn't necessarily meet any kind of timeliness need, but we know what those dollars would mean in our community now if we can go through the exercise of the formal approvals necessary in order to make those happen. So it may not be critical unless it's critical for you and your project and whatever it is that you're working on. And that's what we're trying to be mindful of as we look at how we can schedule these meetings and do so in a way that allows the public to participate. It's important for us to find an appropriate way for the public to participate in our public meetings. So the question is about more aggressive steps that we could take to ensure that people are adhering to social gatherings. We're, on this point, I think it's important for local government to be consistent with the state directives that have been given. I think if there's too much of a patchwork, and we're seeing this nationally to some degree, that different states are taking different approaches and they're trying to respond to the needs within their specific communities. From my perspective in the city of Frederick, the guidance that is provided from the governor's office is consistent with what I think is appropriate in the city of Frederick. We have followed all of the recommendations that have come from the governor's executive orders. Our businesses are adhering. It's a challenge for them, but they're complying with the orders about closing. And non-essential businesses are taking the steps necessary to figure out a way to continue to work, even if they can't be open to the public to come in. With regards to our parks, we have posted signage now that our pavilions and our playgrounds should really not be used by the public. We don't have a way, as part of normal operations, to ensure that the kind of sanitation, the kind of sanitizing, decontamination that would be required to ensure that there couldn't be community spread on that playground equipment is possible. And so our advisory with the signage that we put up, we have 73 parks. To police 73 parks for usage of that type would be a real challenge. And so the guidance that we've put out is don't use the playground equipment. Don't be in the pavilions because it would be difficult for the city to maintain sanitizing or decontamination schedule that would ensure that those are safe. So what we can do is to put out to our community members that the guidance that's come from the state is appropriate. And if people would adhere to that guidance, then it will have an effect on slowing community spread. We have charter requirements that we would have to adhere to. So if we were going to try and change those charter requirements, it's not even something that we're exploring at this point. Our objective will be to follow the process and to meet our required deadlines, which is to have a new budget in place by July 1 of 2020. And I believe we have requirements to adopt the tax rate by the middle of May. There's advertising requirements associated with that. There's requirements in terms of the number of public hearings that we have. We're already missing, based on the schedule that we had adopted back in the wintertime, we're missing a couple of those scheduled public hearings. We're required to have 2. So we're looking now, working with the Budget Office, and we'll be working with the Board of Aldermen to determine how we can change, alter, or condense that schedule to still meet all of our legal requirements, but to do so in a way that is consistent with the unusual circumstances that we're being asked to work in right now. If there are no additional questions, I appreciate your being here, and I appreciate the attention of the public to the guidance that you're getting. We would ask everyone to continue to do everything you can personally to help your community move through this crisis, stay safe, assist one another, and we will continue to communicate as necessary. Thank you.